Dr. Horvath, welcome to Inside South Florida.
Thank you so much for having me here.
We are so excited to have you. It's going to be a fun topic. We're talking to Women's Health, Heart Month, everything in between all of that. And I, as a woman, am excited to hear from you and learn from you today. So let's dive right into everything. What's the significance of Heart Month, and why should we be paying attention and focus on women's health in that?
Yeah, so February is America's Heart Month, and we are trying to strive to reduce the risk of heart disease in women, and we want everyone to join us in the fight against cardiovascular disease and stroke. So I'm a woman, and I understand what it is to be a working mom and wife and daughter, and we're always very busy. So we're always like putting the health of everyone else before our health. So, one of our most important things we have to talk about today is how can we make women a priority and their heart health, okay? Because the truth is that cardiovascular disease is the #1 killer of women. And I don't, the statistics show that women don't know that. The majority of women are not aware that heart disease will be their #1 killer.
And one thing that people might not know either is that symptoms of a heart attack actually are different between a man and a woman. What are some of those differences? Yeah,
so the truth is that the typical heart attack symptom, which is, a chest pressure or discomfort in the center of the chest that radiates, that can go to the left arm or to the jaw, it is the most common presenting symptom also for women, but a good number of women present a little bit differently sometimes, like maybe with shortness of breath or, dizziness, lightheadedness, sometimes even nausea, vomiting and stomach pain. So it can present a little bit different.
And Dr. Horvath, we're not here to scare people or make them nervous. We're actually here to prevent solutions, or to bring up solutions to these problems. And so what are some ways that we as women, what are practical steps maybe that we can take to improve our heart health?
So, the most important thing, and actually the American Heart Association has come up with Life's Essential 8, and it's actually very simple. All we have to do is eat healthier, move more, be more active, make sure you know what your blood pressure is like and control it, control your cholesterol, stop smoking, very important as well. Even sleep better. So, control sugar, cholesterol, all these numbers. If you go to a good doctor, if you have a good doctor, he'll be able to tell you, yes, your blood pressure is high, you need to control it. These are your cholesterol numbers. How can I get them better? So start thinking about yourself. And those are some tips that will help you achieve that.
Great advice right there. Dr. Horvath, where can we go for more information?
Well, you can go into the webpage, goredforwomen.org from the American Heart Association. You'll find a lot of this information there.
Amazing. And of course, find you at Mount Sinai.
Mount Sinai Medical Center. Yes,
there we go. Well, thank you so much for coming in and sharing all this great info and advocating for women's health, for heart health, and Heart Month as well.
Thank you for having me.